Miss Lim, I'm Dr. Ty. Please have a seat. Okay, Marissa, how have you been lately?
You know what, Doc? Actually, I've not been too good. Been having convulsions the past couple of months now. They've increased in the last month, so that's why I'm here.
Okay, so these convulsions, these seizures, how many would you say you've had this month?
Roughly 3 or 4, but I'm not sure because I can't really remember.
Okay, you can't remember. Are these brought on by anything like stress, anxiety, just anything that gets you flustered and then you go into these convulsions?
Not
or
really. I've been like stress free.
Nothing going on at work or home or anything like that?
No. Nothing stressing me out. Just these seizures,
Okay. Well, I just have a, do you have any family history of epilepsy?
No, I have not.
Okay, well, it seems that maybe what you're experiencing is epilepsy, which can be brought on in many different ways, like alcoholism, brain injury, stroke, other diseases that can cause epilepsy.
Wait, epilepsy?
Epilepsy. Or even genetics. And basically, epilepsy is defined as a chronic neurological disease characterized by recurrent spontaneous seizures. So, does anyone in your family have epilepsy, or no?
I said no, nothing really.
Okay, well, have you been in any kind of like, do you drink a lot of alcohol, or is there alcoholism in your family, or do you experience anything like that?
My alcohol intake is mostly just, like those, fun occasions on the weekends, not anything too...
Not anything too serious. Well, have you had any kind of accidents or anything like that?
I was actually in a car wreck. It was a head-on collision. I had a concussion for about a month, I think. So.
About a month. That sounds pretty serious. Were you checked out for this concussion? Because I don't have you in our records or anything.
I don't think it was that bad. Because the concussion went away afterwards. I kind of just forgot about it. So.
So is this when the seizures started then?
Yeah. Now that you mention it, I guess probably yeah.
Okay. Well, with these seizures, I'm going to try to diagnose what kind you have. So, do you fully remember them, or do you feel unconscious when they happen,
I don't usually realize until I come back from, like, wherever, like, the seizure, and my roommate tells me I usually... I feel them coming, but then I don't, like, really remember. It's, like, a weird sense I get. Kind of like, you're gonna sneeze, but you can't, or something like that.
Mm-hmm. Okay. Yeah. So, when you have these seizures, what does your roommate usually describe them as?
She says I usually go stiff, and then I have a period of chronic convulsions, and it usually lasts, like, 20, 30 seconds.
Okay, yeah. Okay, this sounds like you are having tonic-clonic seizures, which is an attack on both of your hemispheres.
Wait, what is that?
Okay, well, there are many different types of seizures, so if you look at this chart right here, I'll explain them to you.
Yeah, so how do these work exactly?
Well, if you look over here again, I'll show you how they fully work. There are many different causes of seizures, but a main cause is an overactive glutamate receptor, and since glutamate is the major excitatory neurotransmitter, It's the glutamate receptors that we tend to focus on. So here you can see that this is the cause of a drug that is trying to reduce the seizures. So basically, the drug will come in and it will inactivate the channel that is letting in all the sodium, which is causing these rapid action potentials that cannot be controlled. So they find the gene that can control it, and then they inhibit that gene as to stop the seizures. So a big thing about epilepsy is that models, like animal models, have shown that the NMDA and AMPA receptors are overactive, and they induce seizure activity because of a kainate agonists that come and turn them on, and then there's nothing there to turn them off.
Can anything be done about this, or am I stuck like this? Or?
You're not stuck like this, but epilepsy is a little bit trickier because the seizures are spontaneous, so we don't fully, know what's the cause of them, so we can't like nip it in the butt, but we can help stop the seizures or suppress them. Sometimes it's a little easy to find where the seizures are low. Okay, so it's a little bit harder to pinpoint exactly where the seizures are located, or like at least what the cause of them are, because they are very spontaneous. So we will be able to sometimes find where they're located in your brain and maybe perform lesions or any kind of surgery on them. Sometimes we even have things like cutting of the corpus callosum, which is separates your right and left hemisphere. So if we cut that, it can possibly stop the seizure from transferring from one side to the other. Another thing is completely even removing one half of your hemisphere, which is kind of crazy, and it's more of something you see in very, very serious measures and in children and newborns, because the plasticity of their brain is a little bit better than ours, as you have developed, learning with both half of your hemispheres instead of just one. Mm-hmm. So what I can do for you, though, is write you a prescription for AEDs, which is the anti-epileptic drug. So these AEDs will not cure epilepsy, but they can definitely help with your seizures.
Right.
They will help suppress them. So we're going to have to experiment because there's different types. So we'll experiment to see which one's best for you and what can help your brain the best. So right now I'm going to write you the most common, which usually helps everyone, and this is a AED that inhibits the major excitatory neurotransmitter amino acid glutamate.
Okay.
So hopefully if we can, calm that one down, then maybe the seizures will stop. And so here's your prescription. You can take this to Linda.
Great.
Up at the front desk. She'll give you a prescription for that. And then also with Susan right next to her, we'll help you make a new appointment. So I can see you in about 2 weeks, I want to say, and see how you've been doing, how this has helped, and we can check up on this, and hopefully you're feeling better and
thanks a lot, You're welcome. Thanks for seeing me.